Hello and welcome back to my channel. My name is Casey Miller. I am an OBGYN physician and recent residency graduate. I have started to create tips and resources on YouTube for current and future OBGYN residents. Before I get started, I want to let you know that I have created a 15-page guide with my top 15 questions that you must ask on your OBGYN residency interviews. It is free. If you're interested in downloading it, you can do so from the link in the description box below. And if you're interested in any other free downloads or note templates that I have created, you can visit my website that's also linked in the description box, drcaseymiller.com/free downloads. Today, I'm going to be covering some tips to stand out on your OBGYN rotation, specifically for those of you who are going into your sub-I rotations. Tip number one is to reach out to the residents well before your rotation actually starts. So if you are supposed to start on the following Monday, I would probably plan to reach out 3 to 4 days beforehand to make sure that you can actually get a hold of the resident. Sometimes the number that you've been provided by your rotation director is not correct, so that way it'll give you a little bit of a buffer to make sure that whoever it is that you do contact can give you the appropriate alternative number to reach. When you do reach out, make sure it's at a time of day that is appropriate where the resident is likely going to be awake. I would probably try to avoid texting them, after 8 p.m. They're probably gonna be awake after this, but just try and keep it professional. Then once you've already talked to them, they're probably gonna tell you what day they want you to come in for day one. And I would probably reach out to them again just the night before to confirm that when and where it is gonna be that you're gonna meet. Tip number two kind of follows off the last one. You want to confirm with the resident the day before what patients you should round on, with the plan of actually showing up on day one and having seen your rounding patients. Now, of course, day one is going to be a little bit of a flex day because especially if this is an away rotation, you may never have been to the hospital before and you're going to be kind of getting your bearings. But if you can use your first day not as a burner day, but as a full-on, I'm gonna show up and do an excellent job day, you're already gonna stand out. So the best thing you can do is talk to the resident the night before, ask them how you can access the list of patients, or at least get the room numbers of the patients if you don't have access to the list. Show up extra early on the very first day so that you can find the resident workroom without any, major delays. And use your first day to make a great example by being there before the residents and rounding on a few patients. A lot of the time, students are going to be using that first day as a burner day, and that's kind of what the residents expect. So if you don't do that, you're going above and beyond and you're already gonna make a good impression. Tip number three is to round on your patients before the residents do. If you want, you can try and coordinate with a specific resident the night before you round to see what patients they are going to be rounding on, and you can kind of choose that resident to be the person that you not shadow, but kind of help out throughout the day. Then if you know that they're gonna be rounding on, X number of patients, you can plan to round on them as well, or a couple of them to start. And to really stand out, get there before they do. And I know that the residents are getting there super early, but you're watching this video for a reason. OBGYN is a very competitive specialty, and if you really wanna stand out, I promise you that if you show up extra early every morning to round on their patients, and you have seen them by the time they get there, they will be extremely impressed. Furthermore, if the resident shows up in the morning and you say, hey, I've already seen these 5 patients, you can sit down with them as they chart review the patient before they go and see them, and while they're seeing the patient, you can work on writing the note. And then if you can get the notes done before the residents are about to write their notes, then they might actually be able to use your note and copy it so that it's gonna save them time. Every time a medical student has done this for me when I was a resident, it was extremely helpful and also very impressive because not all students are willing to show up as early or earlier than the residents, especially when the residents are showing up before 5:30 in the morning. But doing that is not only extremely helpful to the resident, it shows that you are willing to commit to a lifestyle as a future resident that involves waking up extremely early every morning to do your postpartum rounds. Tip number 4 is to introduce yourself to all the laboring patients and their nurses without being asked. It is a good idea to just let someone on the team know that you're going to go introduce yourself to the patients, because sometimes there are patients that do not want to interact with medical students, or more sensitive cases like inductions for fetal demises that generally we don't have the med students rotate on, go ahead and take the initiative and say, hey, I'm going to go introduce myself to the patients. Is there anyone that I shouldn't see? Like I mentioned in the last point, your sub-I is not only to make a good impression and stand out to the residents, but also to demonstrate that you can do this job and you can incorporate yourself into the team. And the team is not just the residents or the attendings. The team is the nursing staff as well, or any other mid-level providers. So if you introduce yourself to any patients, please make sure that you introduce yourself to their nurses and say, hey, I'm the student on today. I would really love to be helpful, because if the nurses know that you're willing to be helpful, a lot of times they interact closely with the residents and they might pass on some good information about you to the resident as well. And it also just shows that you're happy to work with multiple different providers of different levels. Tip number 5 is to make yourself be as useful as possible and just show the team that you want to help out in any way possible. So if there is a patient who came from an outside hospital or who is not within our established network and we have no prenatal records for them and they come into triage, offer to the resident to sign the release of record form with them and follow up on getting their records. If they do come in with their prenatal labs and they have a packet that is this thick, offer to the resident to go through the packet, look at all their prenatals, find all the relevant prenatal labs, imaging, things like that, so that the resident can work on the other things that you can't do. A lot of times, the things that the residents don't have time for or that are the most frustrating things that they have to deal with are the administrative tasks. And that is a fantastic way for you to jump in and be extremely useful, because the residents will really like you if you're willing to help them with the things that they just really don't want to do or don't have the time to work on. This is usually the scut work, but as an intern, you're gonna have to be doing that stuff anyway. So if you're willing to do that as a medical student, the residents are gonna look at you and say, hey, they're ready to be an intern resident. Tip number 6 is to sign up for triage patients as soon as they arrive and let a resident know that you are going to see that patient. Depending on what type of electronic medical record system you have, there will probably be what's called a board, and that's where new patients will populate from into the triage beds, for example. So keep an eye on that board. When you see someone pop up, they're probably not going to be ready to be seen right away, because the nurses will usually do the patient intake and put their info into the computer. But again, just like what I talked about with the rounding on postpartum patients, if you can beat the resident to any task, including signing up for triage patients and chart checking them before the resident even notices that they're there, that's gonna set you apart. Generally, even if there aren't a lot of things happening on labor and delivery or triage, people try to get things done as fast as possible. So if you can operate with a mindset of expediting every single thing that you do as a student, people are gonna notice and appreciate that. Things on L&D and in triage can go from very slow pace to chaotic very quickly. So whenever someone comes in, we are trying to just see them and get things done as fast as possible, because we never know when something is gonna explode a couple minutes down the line elsewhere. Following off of that is tip number 7, which is learn how to perform a limited OB ultrasound and perform that on every triage patient that you see. This means using the ultrasound to assess the fetal presentation, so if they're cephalic or breech, identifying the placental location, and assessing the fluid by the deepest vertical pocket or maximum vertical pocket, DVP, MVP. Hopefully you will have had a chance to have already learned how to do this on your core rotation on OB, but if you have not, just make it known on the first couple patients that you see in triage that you wanna go in with the resident and just say, hey, can I do the ultrasound? Can you teach me? They're not very hard to complete. It will only take you a couple times to become familiar with how to do it. And even if you're not doing it perfectly or you mess it up, it's not gonna harm the patient. You can just have the resident repeat the ultrasound for you, but you'll stand out because 1, you're showing that you are genuinely interested in learning how to develop this skill that you know you're going to have to be able to utilize as a resident. And 2, when you do feel comfortable with it and the residents have trained you to do it and have watched and confirmed that you can perform these ultrasounds correctly, that's just another thing that's gonna save them a ton of time. You see the triage patient, you say, hey, I saw XYZ patient, this is her story, this is her ultrasound. It's gonna save them a ton of time. The resident can type up the note while you're telling them everything that you got from the patient, and you've already done the ultrasound, so they can just go in, see the patient, do the exam, that's it. Okay, we're almost done. Tip number 8, don't ever be idle doing nothing. When you see a resident arising from a chair to go check a patient or do anything, get up and go with them if you have nothing else to do. Ask them how you can help. If they're going to check a patient, ask them on their way, hey, can I learn how to check a patient? They might say no because we don't always have med students checking patients. But if you're there on a sub-I and you're really committed into going into OBGYN, if a patient is comfortable with it, I have let my med students check patients with the patient's permission, obviously. Generally, the more involved you ask to be, the more you'll be let to do. A great way to look bad on your rotation is to be sitting in the workroom, not doing anything, even if we can see on the screen that you're doing UWorld questions. If you want to stand out, you need to be up, you need to be doing something, you need to be helping the team, you need to be always looking for something that you can do to provide value to the team. If there are very few laboring patients, or if there's no one walking into triage, come up with a question and ask the resident a question and say, hey, can you walk me through how induction of labor works? Or can you walk me through how you're supposed to manage a vaginal bleeder? Or you can let the resident know, hey, if there's nothing to do right now, I'm gonna go touch base with the nurses and see if they need help doing anything. The point is to make yourself busy by providing some kind of value to the team. Tip number 9, if you are wanting to get involved with deliveries, I recommend asking the bedside nurse for patients that are about to deliver, the patients you've already met, where you can find an extra gown and set of gloves so that those can be available in the room. Most of the time, there are only gonna be 2 gowns on the table, which is usually gonna be for the intern and the senior, or the resident and the attending, whoever is going to scrub into the delivery. So the stuff that's open on the table is not necessarily for the student. But we do want you to get involved. We do want the med students to have hands over hands experience with the actual delivery, not just the placenta. Where I see students missing out on those opportunities is generally when they don't have their stuff in the room ready and the patient delivers the baby really fast. They just don't have their gown and their gloves ready, so they miss out on the delivery, and then, they end up getting stuck for the end of the placenta or something like that. And finally, tip number 10 is to pay attention on postpartum rounds on the tasks that need to be followed up on throughout the day. Generally, on postpartum rounds, you'll be presenting your patients, or if the resident is presenting the patients, at the end, they're gonna make their assessment and plan. And they'll probably end up concluding saying, so plan for today is to follow up the AMCBC, follow up the EPDS, follow up pain control, and if everything looks fine, discharge later. If you can write all of that stuff down as it's being said, and immediately after the resident says all of those things that need to be done, say, okay, I'll follow up on that. I'll let you know when the results come back, and I'll touch base with the nurse to get the EPDS done. The residents are going to be very happy with you and also impressed at your initiative. Okay, so overall, as a medical student on your sub-I rotation, you have the opportunity to be an extremely helpful member of the team. Depending what institution you're at, how the OBGYN core rotations are organized, not all medical students on their core rotations have the opportunity to be as helpful and integrated with the resident team because they're kind of scattered in different areas on different days of the week. The sub-Is, though, have a real opportunity to integrate with the resident team, make themselves known, become familiar with how things work, and be extremely helpful. Having worked with sub-I med students for the prior 4 years before I graduated residency, the students that stood out the most really were the students that just became a real part of the team and made themselves as useful as possible. There is a lot more to residency than actually doing surgery and performing procedures and deliveries and checking patients. There's a lot of writing notes, there's a lot of following up on labs, there's a lot of signing administrative documents for release of records. There's a lot of stuff that just takes up a ton of time, and if you have someone like a committed student who can help you with those things and is extremely reliable, as a resident, that's a total lifesaver. Before I go, I just want to give an example. So there is a current third-year resident at my program where I work, and when I was an intern on my urogynecology rotation, she was on a sub-I there. She was the only med student that I had for 6 weeks of the rotation, and I actually was on that rotation by myself because my senior was taking a sabbatical. So normally it would have been a 2-person team. It's actually a second year, not an intern. but it was extremely overwhelming and stressful because there was a lot of stuff for me to do every day in between going to cases in the OR. This student of mine saw the opportunity that she had to basically become an intern resident, and that's what she did. She rounded on all my patients every morning before I got there and had notes written and penned ready for me to review and sign before I got there every morning by 6 a.m. She had reviewed all of the vitals, labs, overnight events. So when I got there, I basically was acting like the attending and she was acting like the resident. She would present all the information to me, and all I had to do was confirm that everything was accurate by going through the chart, laying my eyes on the patient, doing a quick exam, and going through her note and co-signing it at the bottom. That student absolutely saved my life on that rotation. She helped follow up on all of the things that I didn't think I was gonna have the energy or the time to follow up on in between all of my cases throughout the day because I was a one-person team. I wrote her the best evaluation that I have ever written anyone, but not only did I write her a great evaluation, I made sure every resident in my program knew how good of a med student she was and to write her good evaluations if they agreed, and really emphasize, especially when it came to ranking, how badly we needed her. And she ended up matching. So never underestimate the power that you have to become an integral part of the team, and not only to make an impact on the specific resident or few residents that you actually see on a day-to-day basis, but word travels. If the nurses love you, if a couple residents really like working with you, they're gonna tell the whole program because they really, really want you to come there. That is all for today. I hope you guys have a wonderful week, and I will see you in my next video.